Romuald Hudecek to you now, and I just found out that he has common ancestry with mine. All these smart people have some great genes. Rom was born in Czechoslovakia. He left Czechoslovakia when the Russians invaded, as did Vera this morning. And he's been in Sweden ever since, where he achieved his degree in psychology. From 1976 to 1981, he did studies in Stockholm, studying the effects of mercury and dentistry on the body. Presently, he's working at the University of Uppsala in the Department of Clinical Metal Biology. He's the head of the Biomedical Dental Center in Uppsala. And on his card he gave me, it says Department of Clinical Metal Biology, and then I assume this is in Swedish, it says Amalgametahetten. Correct? Interesting. Without further ado, Dr. Hudecek. He's a dentist.
Welcome to my little talk. First of all, I want to thank Ed Arana and the members of the committee for inviting me, and I thank you all for coming. If we just begin about putting the first slide on, it little bit describes. Is it okay with microphone?
Yeah.
Hear me, yes. Well, this is a little presentation. There are very many names of many centers. The Center for Metal Biology or Biomedical Dental Center in Uppsala. This is the main institution. The Department of Clinical Metal Biology is a unit of Center for Metal Biology, which is a university institution. And as Bert told you before, it was called Amalgamenheten. It means amalgam unit. This is the old name, which describes the situation from the beginning, because about 1989, we have been all talking only about amalgam. The whole clinic was called Amalgam Unit. Now it's Center for Metal Biology, because it's a lot of many other metals involved in that. We can take next slide, please, or I can take this one. Oh yes, the Center for Metal Biology, this is, as you see, many institution on university level, including the municipality of Uppsala. They don't know what they are doing, they are just paying for that. But otherwise it is even Geological Survey of Sweden, because we are looking at metals in the whole environment, not only as medical problem, but even in environmental. We have some department of geomedicine, looking why people in some special areas are more thick than people in other areas. Locally, we can find very funny situation that, for instance, people who are living nearby crematorium are much more sick statistically than people living other way. And I don't know what is it coming out of crematorium. I don't think it's ghost, it's mercury, of course. We could find it in some places. I will present our patient group, because we are the only one clinic in Uppsala who is taking care of patients from the whole country, different parts of country. And these patients, they are reminders after all other available medical diagnostics and treatment efforts. When they come to us, they have either no diagnosis at all or 25 different diagnoses. The most of them shows a picture of chronic fatigue syndrome. The tiredness is one of the cardinal symptoms in these metal problems. Some of them, or most of them maybe even, are fulfilling the criteria for CFS, but it depends on, because they change the criteria quite often. Some of them are not fulfilling completely the criteria, but they look like that. Then other common diagnosis in this patient sample, which is about, now it is about 1,200 individuals because this is 1 year old. It's of course multiple chemical sensitivity, Zika syndrome, rheumatoid arthritis, or other depressions, some psychological sicknesses, sometimes even chronic mercury intoxication, which is not a unit, and multiple sclerosis or other neurological sicknesses, ALS and so on. This is very common in this group. And we have found different types of adverse reactions in our patients. And of course, the number one, really, we think is allergy or hypersensitivity. It depends how you define allergy. In US, everything is allergy. In Europe, it is allergy is only type 1 allergy. We call it allergy or hypersensitivity, but everybody knows what I mean. To different compounds in dental restorative materials, especially metal alloys. And I say especially because there are some people responding to other things too. Polymer materials, composite resins. We have some allergies there too. Then we find toxic effects of some compounds. And this we don't have to talk too much about because the example for that is mercury. This is recognized like a poison since several hundred years ago, 1,000 years ago. It's harmless in the mouth. But we now know that the natural laws, they are not valid in mouth. And then we find some other adverse reactions I will talk a little bit about, which this is very unsure area, which are related to certain physical and chemical properties of some dental materials, like piezoelectrics. Many of these materials, they are producing electric currents. We have some catalytic effects, which are not very known. Oh, we know them, but not from the mouth, of course. For instance, all transitional metals are potent catalysts. We know that because in every one car, especially in California here, we have a catalyst which is clean in exhaust, made of platinum or palladium. The same catalytic reaction is working still in the mouth if we have the same metals there. And all of these metals, including mercury, are catalysts. Mercury is not count to transition metals. Sometimes it is, sometimes not, because it's lying in zinc group. We don't know this group if it is transition metal or not, but it's still catalyst. And there are some very interesting openings in this field. And what do we do? The most important from when we build up these activities is to make a teamwork. Because if a dentist alone is trying to do that, he will not succeed. If the medical doctor is himself trying to treat these people without help from a dentist, it will not work. Then we have, of course, some laboratory specialists like Vera, and we have to have some screens for what we are doing. And we need, of course, dentists because they have to take this nail out of the foot. Because this sickness is a nail in your foot, you know. And you can have approach to medicate this nail with painkillers. Or you can refer people to go to psychologists or shrink to learn to live with that nail in your foot. Or you can take it out. That's why we need dentists. And we have not to forget about dental laboratory technicians because they can hesitate, they can just jeopardize all the work. Totally. I have seen a patient who was strongly allergic to gold. It was many years ago. In that time, we used sometimes titanium crowns. And we get one titanium crown, we cemented it, the patient get terribly sick. And Melissa didn't show any reactivity to titanium. I thought there is something wrong. Of course, we took away these crowns and we have been looking at that. It was gold plated. And he didn't tell me. Then it needs that you have to have a good contact or your own dental laboratory to control the whole chain. If you are not controlling the whole chain from the beginning to the end, then you have problem. And what do we do? The dental part of treatment, it's our concept which we call the individual biocompatibility concept, which is something different that normally meant biocompatibility is on population level. If 99.9% of people are not reacting to a material, we consider it very biocompatible. But it is totally irrelevant to one person who is reacting to that. He wants to have material which is good in his mouth. That's why we have to restore the teeth with biocompatible materials on individual level. If we are not doing it, then we have this percentage of failure. And when we remove these undesirable materials, we have to follow the protocol for minimal exposure, because we are exposing people dramatically sometimes when we are drilling in materials or working with them. And of course, we use maximal possible protection, which consists of both of technical equipment, but mostly of strategies, or I'd like to say common sense. 90% is common sense and nothing else. It's not expensive, all this equipment. It's common sense. And supportive medical treatment. We don't use too much detoxification programs because we are not allowed to in Sweden. This is why I don't call myself alternative dentist. I am very little alternative. I am just a school medicine dentist, because we are very isolated in Sweden. If the illness does not exist, then you can't use any treatment for that. It's logical. If I use treatment, then I am malpracticing, they take my license. When they take my license, then I can use any alternative medicine I like because I am not licensed. I am natural therapist. Then I wait, when they take my license, I will jump all of the things. That's why they forced us to use standard procedure, the normal science. Maybe that's why it was good, because on some way we have to prove things we are saying. Some clinical cases, 10,000 clinical cases, still no scientific proof. It's only interesting phenomena. Even they say the National Board of Health in Sweden, they have been visiting our clinic. They call it visit, I call it checkup. And they told me, if you have 100 people sitting in a wheelchair, they jump out after your treatment and start dancing. There's still no scientific proof. And you know, just by definition, they are right. We have to have controlled studies. Otherwise, we are lost. Otherwise, we can sit and talk 25 years more about that. And they will kill us by this argument. Show me data. And results of what we are doing is that we are expecting normalization of biological markers levels. We use the whole battery of standard examination for different levels of mercury in blood and urine and everywhere, all these standard things. Some liquor analysis for B12 deficiency, because it's very common in this group. But what is special a little bit, we use MELISA, of course, in everyone since many years ago, and we use nuclear microscopy, especially PIXA, which is proton-induced X-ray emission. It is not easy to use it in everyday practice because you need an accelerator to do that. And not everybody has it at home. But as I am connected to Uppsala University, I'm happy to use that. And I used to say this nuclear microscopy is very nice scientific proof of both thickness and recovery, but it is not saying us why. This is just a complicated thermometer. But as far we have to prove that the patient are really sick, and then we have to prove that they really recover. Because normally you ask a patient, are you feeling sick? Yes, and you believe that. No, these patients has to prove that they are sick scientifically. And then when they recover, you know, because you can imagine all of these things, then they have to prove scientifically that they get better. Not only feeling better and working and everything. we get this normalization in these two biological markers, which we do parallelly, and this is nice because they are independent. There's different ways to show that people's ASIC are getting better. And then, of course, the functional and subjective health improvement, which we can now see in about 90% of our patients. And when I'm talking about improvement, it's at least remarkable improvement, not just very little improvement. This is counted to this 5%, which are not better or some of them worse. Now we will come a little bit about it's dental pornography, I will show you. I think we have to show some teeth, you know. Anyhow, this is a standard still. Looks very nice. It's look like teeth. The color is perfect like teeth, isn't it? It's no corrosion at all. But this is old-fashioned things, of course, but we still see it everywhere. This is Lichen planus, a giant amalgam crown. This is the only one condition in Sweden which shows that if you have that the insurance will pay the removal of amalgam free. But what they say, we pay for the only nearest amalgam. From beginning it was all amalgams, now they are saving money. The nearest amalgam, because it goes away when we take this away. It means that we have patients who are allergic in one place, not allergic in second place, little bit allergic here and not allergic there, by insurance standards. But you know, stupidity is forever. You have the same problem. And if you can show allergy, that it is too free. But otherwise, the Swedish parliament decided that people who are chronically sick, they don't have to prove if they have some adverse effects of amalgam. We can still change amalgam in everyone who is sick, if they ask for that. And then we can take away amalgam and change into other materials in anyone who wants it, but they have to pay 100% price for that. Then we are free to take away any material we like if the patient wants it, but it's only different prices, from free to 100%. Then we are not restricted on that way. If the patient is totally healthy, then we do it of aesthetic reasons. This is an indication. If I have indication aesthetic look, then I can do that.
Does the patient pay for that or the insurance?
Or the patient pays for aesthetic dentistry. Then we remove amalgam and we have what left? Very healthy tooth tissue. Nice and white colored, nothing left. Because this you don't see on X-ray, it's away metal. It's a corrosion products. You know, the amalgam has always been disaster. But it's a good system for old-fashioned dentists because it breaks the teeth apart and they have to come back and make a new one and new one. You know, it's a self-keeping system. If you restore it, you know, really good, then you don't have any job on this patient next 10 years, you know. It's a bad business. This is really pornography. It looks very biological. When we remove amalgam, we have still some screws and forks and knives and whatever left. A junkyard of metals. And you see the tissue is very healthy, not bleeding, not inflamed around that. I'm sorry, it looks like that. I did it myself many years ago, such a things. But it's just to remind how it looks. You know, you are talking about biology. Sometimes the dentists are accused that we are very eccentric people. This one was very eccentric, 45-degree eccentric. Then, of course, this brass gold-plated screw was in the bone. And when we took away this root, the patient lost 25 different allergies, including allergy to cats and dogs. And it means that type 4 allergy, it is a special allergy for itself, but all of these 4 types allergy are working together. Because in our body, we don't have 4 wardrobes with one type of allergy, close it, open next one. the TH1 and TH2 axis, they have a lot of feedbacks in between. That the metals, they are maybe playing central role in all kinds of allergy. We have seen people who totally lost asthma after 25 years because of 2 amalgam crowns as a secondary benefit to that. But it's still a lot of work to be done to show it. Here is the official report from 91 in Sweden about reported diseases per 1,000 employees. It's for women. And as you see, the dentists, they are the most healthy people. We are really sick. And of course, everybody say, oh, you are stressing too much. As medical doctors, they don't stress. The same with nurses. Dental nurses are much more sick than any other. I don't think this is coincidence. Of course, they divided it into something chemical, physical, biological. I really don't know what they mean by that. No one of these criteria is amalgam in it, because amalgam doesn't cause any sickness, of course. But this is something to think about, because we get our part of these problems because we are working daily with those materials. We have to protect not only patients, but we have to protect ourselves. This is now everybody. These 2 teeth I just sent in vivo in a session in the Swedish parliament, because they never remember papers, but they remember if they get 2 teeth in the hand. Oh, it's terrible, it's ugly, my God. What? You know, I think these 2 teeth made quite a bit in this way when we had this ban of amalgam, especially this one to the right. As you see, this old-fashioned gold crowns, very old. The one is little amalgam left. And what happens, of course, that the corrosion production, it goes to the root and makes the root what? The whole root is allergenic now. To a sensitive patient, it doesn't help to take away the restoration. Now is the question, when do we take away the whole root, when we just clean it? Oh, it depends, because medical doctor says to us, you clean it, you take it away. Oh, in this case, I can use dynamite to remove things. But we still, dentists, we have to restore the bite. Because people, they want to have, teeth and to smile with and chew. Not when they are sitting in a wheelchair. They say, oh, take away all of that. When they recover later, why did you take all of my teeth away? Then we have to make compromises. It's always a question of compromises. That's we have to find when the root canal or root toxicity or allergenicity is too high to leave it, or when we can just to try to keep it. And we are really trying to keep a lot of these. And then it depends on severity of illness. If somebody is coming with progressive multiple sclerosis, and the tooth is not absolutely necessary to have, then I'd rather take it away. If it's functionally absolutely necessary to have it, I try. But I have to be prepared to take it away anyhow. Another root one. It's a little bit special because it's the beautiful typical color for the tooth on the root, but it's very short. Why it is short? Yes, it's why? Well, the body doesn't want that.
That's right. If it's vital, the body will get rid of it, especially with
Absolutely. And if we cut that, there was a big, large amalgam, but it is not now, because when I opened that, it just came some powder out of that. It was completely disintegrated, and all of this mercury and other metals are in the root now. This one, you can see it in the color. This is sick. You don't have to make analysis of that, but we do, because we have to prove it. This is the first one. You see, it's about 823 micrograms per gram mercury in it. It's about 800 ppm. It is almost toxic. Just by according standards, any toxic standard, this is toxic level. You see, we have some lead. Another one root, which was a little bit lower with mercury, has a lot of cadmium instead, 778 microgram. It's good to show, because if you can show it afterwards, then they approve that you did take away. Now we are working about one technique to test these levels before we take it away. But I am not ready to tell you about that today, because it's not ready, the technique, but we are using solution of EDTA rinse it, and we get some amount of metals in this sample. But what we have to do now is to compare with quite a large amount of healthy tooth, because you have to show the difference. And we are now waiting for some people who wants to have healthy tooth firstly opened and then extracted. And we find them, but in children, by orthodontic reasons, we have to take it away. But still, we have to have approval of ethic committee, and this is a little bit problem. But I think we will come with that. And we have another batch, which is a sample taking of what metal is it in your bridges and crowns. This is just a polishing disc, a special batch, which is controlled. It's a Swedish laboratory who gives it to us. And just normal standard polishing disc. Look like any available for polishing composites and things like that. But it's a special tested that it's metal free. And we just polish in 30 seconds. And the laboratory give us analysis down to 0.1% of any metal which is in it. And quite a cheap analysis because it costs about 50 bucks. I have some protocols, but I don't have on slides. I will show you later on overhead, because it's funny to find what, for instance, titanium bridge can be in. Now we are, for instance, this patient gets, he was allergic to palladium and chromium and cobalt. And he got the gold prosthesis. It was very cheap, I hope. But it contains 12% of palladium again. You know, the stupidity is forever. But before you destroy, you cut a piece of that. You can just polish it and you don't destroy that. This is another interesting thing. I think the bird will be interested, because this is lichen ruboplanus, a giant to something else than amalgam. You see a little bit what is it. It looks like that. This is lichen ruboplanus made of screws. And I don't think this one tooth is mentioned in Guinness Record Book, but it's almost. What do you see? I will come back to that because of these catalytic reactions. They put more and more screws and try to restore this tooth with composite, and it would disintegrate in 1 month, falling apart, like in strong acid or whatever.
Galvanic effect?
No, it's not galvanic. It's catalytic effect. I will tell you just in a minute. I did take away that. It was 7 different titanium screws and 4 more holes in the tooth. Earlier trials, and nothing worked. And we can maybe stop a little bit with this titanium, which I'm coming from Sweden, you know, and we have very much to do with titanium implants because of Professor Brodemark. But I am now personally very suspicious against this metal. We can show in Malaysia when people are sensitive to titanium. The patch test will not show it, because they test in titanium dioxide, which is not soluble. It doesn't go through skin. The titanium is very much transition metal, one of the most active in them. It's light metal, it's not a heavy metal. And it has some very special chemical properties. The pure titanium is never pure because it's immediately covered by titanium oxide layer. Then all contact with living tissue is always through titanium dioxide. This contact, you know, when the surgeons are putting these implants, they are in vacuum tubes, you know, and they make the hole and they open these vacuums and very fast they screw it in because it's not supposed to be exposed to the oxygen. It means that in blindness there is no oxygen, of course. They put it very fast, because otherwise it will be. And of course, it is shown that the layer of titanium dioxide will grow every year on these implants. It's only 100 angstroms from the beginning, and that is micrometers later. What is interesting with titanium dioxide, which is very common and very innocent coloring substance, it's used everywhere. You have in most of toothpaste, you have about 5 to 10% of that, even when they are blue, but still, they want to have that. Why do they have that? It's not because they want to have it white, really. But they only can call it like color pigment substance because in this case they are allowed to put it there. If they call it by bleaching substance, they are not allowed to put it because it's active. This is bleaching teeth, titanium dioxide. Especially all this research is coming from US, especially from California too. And about this titanium dioxide, which is absolutely innocent, inactive substance with no biological effort whatsoever, they have 3 international conferences in California last year talking about biological effects. This is funny. Why do they have such a large conferences about nothing? If you look about titanium dioxide, you try on internet, you find a lot of databases. The half of them are classified because it's NASA's. All this space technology is building now on titanium dioxide, especially new solar cells. The solar cells, the newest, yes, is much more effective than silicon. And there is another one coming out from US. It was the trials, which are now commercial soon, to clean polluted water with titanium dioxide, because this is the most potent catalyst to break down organic substance. Must be good to have in mouth. What they did in Nevada, they just put some polluted water with whatever you like, oil, trichloroethylene, detergents, whatever, organic. And in 4 minutes, it will turn to carbon dioxide and water if you put some solar energy on it. You don't have to concentrate it, just like it's today. Titanium dioxide is recognized, and it's called photocatalyst. Very extreme catalytic substance. And if somebody tells me that it's not breaking down organic substance in my oral cavity, then I don't believe them. You maybe remember, because it's American product, to Magic White bleaching set, which is now forbidden in Sweden. It was pure titanium dioxide and hydrogen peroxide, because these two things together, they are bleaching everything. Of course, if you are sensitive to that, it will destroy your gums completely. That's why it's forbidden. Some people lose some teeth because of that. Yes, but it's always titanium dioxide is potent catalyst to take down all organic or discoloration in enamel. They are organic. Maybe that's why this composite restoration would not stay. It was just powdering of that. And of course, they say, oh, you need ultraviolet light to have this catalytic effect. Yes, this is known. What is not known, or maybe possible, what happened with electromagnetic fields. Now we are jumping another one controversy, because we have these patients too. Do we have some activating of these catalysts by electromagnetic fields or not? Nobody has been looking for that. I found that some infrared activation exists on titanium oxide. I wouldn't be surprised if normal electromagnetic fields will activate this thing too. It is just a little preview about future problem of this special catalytic and piezoelectric effect which most of composites have. They are producing currents. And if they are not causing any electric harm, at least these currents are large enough to move these metal ions from one place to another, out of the root, in the root. We have to be aware there is something more than just only allergy and toxicity. There are some funny things too. This is the same lady. We have a gold crown, some beautiful amalgams, nicely shaped there. Some of them they have been shooting by I think, with the gun to place it there. And the titanium post. And we see it. We don't have to X-ray it because we see it here. If you take biopsy of that, you have unspecific inflammation, foreign bodies, and necrosis without any bacterial invasion. And if you make analysis of that chemical, then you find titanium, copper, and silver. It is the parts of the gold crown are coming out is not the most precious. The gold stays in the crown. All other metals goes to the tissue. If we take the same lady, sorry for that picture, but you know, when I took this picture some years ago, I was a happy amateur with photography. Now I have people who are doing pictures for me that looks better, but anyhow, it shows the principle. One of these teeth has a titanium post. We can guess which one is it. Titanium and gold, according to our experience, are two metals which are not compatible at all. And Vera didn't tell you about frequencies. We have seen two in MELISA frequencies. The gold and titanium sensitivity goes together. It seems to go together. I will not tell you figures because I don't have in my but this is two metals which absolutely don't go together, and it is quite understandable because if you take the periodic system, they are lying one there and one there. They are electrochemically not compatible too. But we mix them, very happy. Yes, I was a little bit talking already. It's catalytic effect of transitions metals. All of transition metals have these catalytic properties. Titanium dioxide is one of the most aggressive one. We have lead oxide, which makes the same. We have zirconium oxide, which is piezoelectric. We have a lot of those phenomena, which we know very little about, but we have seen them in some of our patients who are sensitive to electric and magnetic fields. Some of them recovered completely when we took away that. I don't know why, because all of them I've seen up to today were also sensitive in MELISA to many metals. I don't know if all electrosensitive patients are allergic to metals, because I've seen just a sample. It would be nice to have a screen of them. Oh, this is government report in Washington, you know, and it's $1 billion business already. They are now producing here, I think it's California really, a machine who will clean air in-house. Just through the air will go through the machine, you know, with titanium dioxide, and nothing will leave it. Purification, you know, which is completed in instant. And then we have some patients who comes who have already removed amalgam, and they meet some dentist who has been studying in Mongolia last century. I'm sorry to say so, but not all of colleagues are serious in this work. And you know, the dentist who has too few patients, they are jumped at this changing material business because you get a lot of patients. They've been seeking for dentists who wants to do that. And of course, I used to say, if the dentist has to make, you know, advertisement seeking for patients, then don't go to him to make that, because it looks like that. Porcelain inlays cemented with phosphate cement looks beautifully after 1 year. And this is bad because this gives these new materials bad name. But this is just bad performance, you know. This is bad carpenter. Anyhow, nobody says the wood is wrong when somebody built a house which falls down. There's nothing wrong with the material. But in dentistry they say, you see, this is only 3 weeks and you get a lot of decays and things like that. No, we just have to learn our job. Oh, this is my office. You see, this is just standard equipment. It's nothing special. Only this one tube up in the roof, which is a mercury filtering apparatus. It is not made with charcoal and filled with some. It's catalytic. The same principle as in cars, but a special catalytic ceramic which is taking mercury away. And we have made some trials and measurements. It will clean the whole room in 15 minutes completely when it's polluted with mercury vapor. And it's going 24 hours round in 3 years. You have to change the filter once every 5th year. It's not expensive. This is not sucking air, it's blowing fresh air at the working area. It's not helping instantly, but it's helping to keep the area free of mercury. It's the same meaning. It's not only good for the patient, it's good for the dentist and stuff. Because I don't want to breathe mercury vapor, even though I am negative in melisa, I can eat it maybe, but I don't like to, because you never know what happens in the future. And now I'm talking about this removal system. We have to remove these materials protectively. As you see, we have different RPM in different machines, and we have to know what to drill with what. We are not using just 500,000 RPMs on everything, because we are producing tremendous amount of particles and vapor. Then we are mostly using 200 RPMs. But still you find that different materials are easier to cut in different speed. And the aim is to cut as little as possible. That's why we have different machines. And we use this standard suction piece, which is called Cleanup. It's a Swedish invention, which is now available in US, which is a beautiful thing. It's not perfect instrument, absolutely not, but it's the best one, routine, very cheap, single use. It is perfect protection even in children's dentistry, because you cannot touch the burr with your tongue or with your lip if you have this one around the tooth. It's a perfect mechanical protection, but what's more, it makes that 99.8% of everything you drill comes through that. And we have made just recently measurements, the little study which is not published yet, and we find very funny thing, that no mercury vapor will be produced. No. Zero. And we measured with Jerome instrument, the direct instrument, you can measure mercury vapor. We thought there was something wrong with the instrument. Then we switched to regular suction. Of course, it immediately shows 120, 150 ppm. Then we did it in 3 different dental practices, 3 different doctors. It all the time showed the same. And some experts in physics, they cannot explain them, and they say maybe because you have perfect cooling, because the aerosol inside this closed compartment is so strong that you cool it very effectively. And this is very good for the tooth substance too. You don't cook it. And maybe the solubility of mercury is higher in this fine aerosol. We don't know. We don't have explanation. We can just show that it is no mercury vapor produced at all. Then we don't have problem to evacuate it anymore.
You say that's available in this country?
I have seen it in some advertisement somewhere in US already. The Bioprobe has an announcement about that.
Ask it tomorrow in the panel discussion, because we have that phone number.
Yes. And you see, the cleanup is just, it has to be tight. But not always you have all teeth in place perfectly, or maybe sometimes you have very long teeth because of this dental treatment or parodontosis or whatever. Then you have sometimes to tighten it. If it's not if not so tight itself, then you take some piece of cloth made of glass fiber. You make a hole in it and you tighten it. You see how much amalgam particles could escape otherwise. Of course, the absolutely best combination is use rubber dam and cleanup together. This is absolutely the best, but it is not possible always to do that. Sometimes, you have amalgam halfway on the root surface somewhere under the bone margins. It's not easy to make a tight rubber dam. And we are not only talking that this works, because we have to measure what we are saying, because without numbers, without measuring, I will show just later. And the next principle is to drill as little as possible. I used to drill a large amalgam filling about 10 seconds. I just take away undercuts, nothing else. Then I take this very special instrument, which is old amalgam stoppers, which I shaped another shape, and I bend it away. Then this is very easy, but it's common sense. If you drill very little, you don't have to worry about particles, which you are not producing. Some people are doing, things like that. They are drilling old-fashioned way, making a lot of this exposure, and they are giving people steroids to cut the reaction down. Well, this is good. Of course it works. It works. You don't get reaction, but you get all this mercury in your brain anyhow. The best way, to avoid poisoning or allergic reactions is not to produce that, not exposing. And we have made, this is one of my colleagues, we have made measurements of what happens when we drill with different things and different equipment. And I will show you some, it's bad copies of scanning electron microscope pictures. These little holes here, it's half micron. This is holes in a porcelain body which is sucking the air. And all of this is amalgam. We have seen 1 or 2 germs there. These particles, it is not vapor, it's particles. They're invisible, 0.1 to 40 microns. They behave like gas. They are flowing in your office if you don't suck it away. And you are breathing it in your lungs, and they produce mercury vapor. If you see at this very, very small particle size, and you cut a large amalgam filling into the pieces, you get an area which is like football stadium, something like that. It's enormous large area we are producing. This is regular standard suction piece, which all dentists have ever used. This tube only. This is a pieces of composite material. They are a little bit larger. Amalgam, as you see, is very small particle. We take next one, which shows you when we use cleanup. And this was measurement, I remember, because I did it myself on very, very difficult tooth. It was, I think, the second lower molar with amalgam crown, which was very difficult to get access to. And we drill it out. As you see, it is much less. It's about only 10% or less. And if you use rubber dam and cleanup together, and this sample is taken in my colleague's office during the whole working day. This is 8 hours. You still find some amalgam particles, but it is always almost totally clean. Then you can say that this equipment and this technique is effective, because you can show it. Otherwise, there are many devices who people say, this is good for you to avoid that and that, but they never show you some proof of that. You have to do the basics. And we are working non-metallic, as we say. We don't use any metals at all. As you see to the right, there is a gold crown with gold post, a little bit short, a little bit eccentric. We're coming back to this eccentricity in dentistry. And we are using, for all posts since 7 years back, carbon fiber posts, which has several advantages, because carbon fiber is not only biologically much better than metals, it's almost inert, but it's much stronger than any metallic post. If we glue it together, if we are able to glue it together with a tooth, we get exactly the same parameters of this carbon post as the dentin itself. It never breaks. And then we use ceramics. In this case, it is in ceram crown, which is disaster too, because you see if it fits or not. The gold crown, you don't see if it fits. They can check you with that. It looks like that, and we used to build up the core, as you see, completely without coloring pigment materials, polymer materials. It looks like glass or plexiglass, because it's absolutely not interesting what color is it inside. I really don't know why do they have different colors there. And the crown on it. We have very good experience with those carbon posts. Now in Sweden, it's now 7 years after the National Health Board just recognized that it is okay to use that. Before it wasn't forbidden, but it wasn't allowed. I was half criminal to do that, but now it's recognized. After that, 500,000 of this post has been done. And Sweden is a very little country. We have only 8 million inhabitants. Then 500,000 posts, it's quite a lot. Sometimes we have almost nothing left. We have to use these posts everywhere, because if you want, this is root-filled teeth, every one of them. And I am not fanatic in taking it away. One of my colleagues in Munich, he is just taking everything away, but he's surgeon. Then he refers patients to a dentist to fix it. And of course they cannot fix it. We are trying to fix it. This is all built up with carbon fiber and a special kind of polymer material. The last one is in porcelain made. I don't know why, it was just something we had to try. And then we put the whole ceramic bridge on it. We use this ceramic, this is in ceram. Just a short.
Do you use the shading, the different coloring on the porcelain?
Oh yes, we are doing it, but we are hiding it in the middle of porcelain, not on the surface, not inner surface, not outer surface. This is a special technique which our technicians done. He discovered one thing, the tooth will look nicest if you do it like natural tooth. You put the color inside, and then a layer of something which is translucent, like enamel. It's just opposite to die-cut technique when you paint it on surface only. And it looks like that. Of course, you see you cannot porcelain. You have to have some volume in that, because we have still fighting these problems with is it holding or not. We have some bridges which are broken now, of course, but it's the same percentage as gold bridges. We have some little approach. I will just show you this carbon fiber post with a special technique. This is very funny case, because this was a very high governmental official coming to us and asking what to do about that. I said, okay, we can try. But he wanted to have second opinion, and then he called, odontological faculty in Stockholm and asked the head of department of diagnostics there what to do with that. I said, it's just to extract. It's nothing, absolutely nothing to do without. And as you see, the sinus is very large. He has no place for implants, and he wanted to have his teeth. He had a gold bridge with extension behind. And he asked, but there are some guys in Uppsala that told me they maybe can do something about that. You don't listen to charlatans, because this is absolutely stupid. And okay, we glue it together, this one, with carbon fiber and super bond, which is 4-meter bond. It's just a little picture. And we put back his bridge on. I'm sorry, because it has been functional now in 3 years. It's a stupidity, as you see, because the extension behind, you wouldn't do it. We do it. It works. And he called this faculty and told them, what about these charlatans? You have much to learn. And this associated professor called me and said, what did you do with that tooth? Oh, we glue it a hoop. We glue it together. With what? With a glue. You can come to our courses. And I'd like to show you now picture 3 years after. But this official is very high. He doesn't have time to come for checkup. He called me. I have no problems. I think we'll find today recovery of the bone. We have seen it in several cases. It's not only one. Of course, it does not succeed every one case. But this is, between these root segments, it was granulations. We have to burn it out with electrotome. It still works sometimes, or quite often. Another one, it's a fracture of a root-filled tooth, which goes way below the bone level. And with the same technique, without carbon fiber, because only with this, you see, we can separate these pieces. We just use the same polymer material. We put it together, and we glue it together. It works about 3 years now, too.
That's 4 meter?
It's 4 meter. It's called, in US, it's called Superbond. It's Japanese. And the latest publication about that showed that this is the best thing you can put on your pulp if it's open. If you put another dentin bonding like 3M or whatever, Scotch bond, the pulp will die if it's exposed. In these cases, they opened about 100 teeth experimentally. All 100 are alive half year after. And it is both enamel and bonding denting in one piece. And it's the perfect material for bonding this carbon fiber. It's chemically hardened, it's not light hardened. It has very few substances in that. It's very clean metacrylate.
Is it etched before you bond?
Oh yes, you etch, but you etch with citric acid. There's a special acid, but you can take your onion or whatever.
Carmel makes them.
Sorry?
Carmel makes them. It's for metal bonding.
Yes. You know, in Europe it's sold by Morita company. I don't know who has it here, but it is available here. As you see, sometimes experimental, we have some people who are, now it's upside down, but it doesn't matter, people who are allergic to all kinds of root filling, especially gutta-perca. Then we did some root fillings with endopost, which is carbon fiber, which is very thin, the same size as your root canal instruments. And we bonded it down to the apex with superbond. And you see it heals. I didn't find one single case when it did not heal. The problem is when you have to go there and to remove it. It will sit really hard. But the carbon fiber post you can take away because it's 5,000 fibers together. Or in this axial direction, you can just drill it. It's easier to take away than a gold post out of the tooth, which we are doing every day. But you see one example for complete healing after this. This is alternative root filling material, which we do when we really don't know what to do. We can only do it in stride channels. We still don't have this bending, but maybe we'll get it. And of course, this is just example of true root fill teeth with carbon fiber post build up and in-ceram crowns, which you can, this is the next thing. In-ceram and Procera, this is the only two ceramics which you can cement whatever you like with. This is strong enough, you can just treat it like gold crown. You don't have to bond it. Of course, we bond it as soon as it's possible, but in these quite rare cases, patients who are allergic to polymer materials, we have to go back to phosphate cement. And this is the only porcelain which will allow it to, even bridges. You have a choice. If you use anything else, any other porcelain, and the patient cannot have the bonding agent or allergic to that, then it's out. It's only these two ceramics, in-ceram and Procera, you can do it up to now. Procera is a Swedish thing which is the same chemically, exactly the same as in-ceram. They call it Procera. By incidence, it's made, the same company has made Bronemax implants, Nobel Pharma. It is more compacted, more, it's fired with higher temperature, and it's even 30% stronger. But they can only make single crown. They cannot make bridges. Because it's expanding and it's shrinking, you know, it's computer-made thing. It's stronger than gold crown. But, you know, we don't need things which are stronger than teeth itself. We just need to have them functional and biophysiologically right, then it works. Yes, I am just writing about this. Then one is in-ceram, the other is Procera. This is only to high firmness porcelain, as we call. All other porcelains, including Empress or Fortress, which is the latest development of Mirage, they are low firmness porcelain. You have to bond them. Sometimes, if you are very lucky, you can have an Empress crown in some front teeth, which are not very, very much loaded. Then you can survive without bonding. But it's jeopardizing the crown. Only these two you can use what you like. That means that you have a choice. This is low firmness porcelain example only. You have to bond that. This is veneering. We can today, you know, before I jumped into this business, I was a little bit working with aesthetic dentistry. That's why I came to this business, because I will be seeking for a dentist who can work with something else than amalgam and gold. I'm not doing it now. I don't have time for playing with that. But sometimes, it comes ladies which are in disaster and I have to help them, and I'm very weak in my heart and I do that. And the principle for preparation in ceramic procera is very alike. As I told you, procera is more stronger than you don't have to prepare so much in the margins. You can have almost bevel. All other porcelains is better if you make quite a strong margins. And now we come to bridges. Why bridges broke? And I've made myself quite a discovery. I really didn't discover anything. I just went to the lesson 1, page 1 in architecture book 1. How do they build bridges in 13th century? They make an arch, which is convex to the force, and it will hold. This is in ceramic. You see, the in ceramic is the inner layer, and then you have normal porcelain on that. If you have place, or you can fix that you have place to make an arch which is convex up to the mastication force, then you don't break it. This is just very simple rule. This is the upper one. We don't see it now, but anyhow, it doesn't matter. It was the first one. If you have it straight like that, it will break in the middle. And you have it hanging, it looks like Golden Gate Bridge. It will only hang if you have steel wires to support it with. But we don't have place for steel wires in our mouth. You see, the place between these all three bridges, even the upper one, which we don't see, is exactly the same. It means that your dental technician has understand this construction and made this arch. And since we started to make always the arch, we never have one single broke of ceramic bridge.
How long have you been making it?
The oldest is about 6 years now. We have been about 40, 50 large bridges, 10 units or more, 10, 12 units, and about 150 smaller bridges than that. It is not too much, and maybe in 10 years everyone will broke. But, it doesn't matter because we have been forced to do that because our patients, they cannot have anything else. We have to do it. We can call it temporary, whatever. But it's showing now that the follow-up they made in Germany, followed up 6 years follow-up, they have very good results with that. And we have a little bit better because we are making the arches. If you have an old-fashioned stone bridge somewhere in the middle Europe, they do that. They even don't have any cement in between these stones. They are keeping form itself. This is lesson 1, architecture, how to make bridge. Funny, that the dentists are not reading how to make bridges. If you build your house, you use this principle. If you build a bridge in the mouth, you don't use them. This must be some law, that all other laws, both national laws and natural laws and these laws, they are not valid in the mouth, but anywhere else. Then this is not discovery, it's just common sense again. It's nothing, I'm sorry I didn't invite that. They did it in Roman time somewhere. We have a side bridge like that. You see, it is a little bit clumsy. You have to have some volume. Maybe we can in the future make it smoother. Well, we don't dare to. We are just careful about this because it costs some money too. We can take next one, which is a little bit larger. 3 hanging units. You see a little bit from the side view that there is an arch. It's not supposed to be very high arch. It's enough like that.
Why can't you take the carbon fibers that you can use and make them thinner and use that for support inside the matrix of the ceramic? It wouldn't work.
No, not carbon fibers. There is some works done with glass fibers and composite. They call it now Vectis. It was composite play before the name. Before that, you can reinforce ceramics with zirconium. They are working at that one, but I haven't heard about carbon fibers and ceramic because you burn it, Yes, it goes to 800 degrees Celsius, then you burn the carbon.
What about a reaction to either zirconium or aluminum in the body?
Yes, the question was about reactions about aluminum and what, zirconium. Yes, this is not containing zirconium. It's two different things. Aluminum, which is in the form of aluminum oxide, is considered in medicine like very inert substance. If we compare with titanium oxide, this is very active bioceramic. Aluminum oxide is very inactive. And we have made some research about what's coming out, because when we are talking about allergenicity or toxicity, it is not interesting the content in percentage. What is it in that? Is it bioavailable or not? Does it come out of that something in ionic form? Because if it's not coming out of that, the immunocompetent cell cannot react. And we didn't find, firstly, very seldom allergic reactions to aluminum. It's very rare, if I can say so. It's like silver or less. And it doesn't come out of this aluminum oxide, which is vitrified very hard.
But the aluminum has an energy field which affects the nervous system. Just like Dr. Harada was saying about
Yes.
the titanium has an energy field which
Yes.
affects the system. It's not ionic coming off, but energetic.
I don't know, because if you say aluminum oxide is not metal. Aluminum oxide is oxide, it's ceramic.
But it's
And I don't know how it works with energy fields. I really don't know. But it is like you will be asked me if normal salt, if it is chlor gas and sodium. Sodium will explode and chlor is poison. If you put those things together, then it's inert. It's saline. And the same sometimes happens with these metal oxides. Aluminum oxide is not aluminum. Titanium oxide is not titanium, but it's very active oxide. We have active and inactive. I really don't know about these energy fields, but we don't see any adverse reaction to that.
For the question you just asked there, we have tested insurance. For the most part, it tests out pretty clean, except for when they were using some of the contaminated bead porcelain that had radioactive materials in there. Because they do a traditional porcelain bake-on to the substance.
Oh, yes. Yes, there are some. It depends on which is the covering porcelain. We had some in the past. We had some with uranium salts to make translucency or the luminescency. It is not allowed in Sweden to do that, but maybe it still is somewhere. We are using Vita's porcelain, standard porcelain from Vita, and we have control. What is it? You can use any porcelain around this inceram. But we are using the system Vita is recommended, and we are not changing. The pollution is important, yes.
The bead porcelain, I think, contains coral, if I'm not mistaken.
Yes.
Using uranium oxide or whatever it is.
Yes, just to make translucency and luminescency. And it's funny because if you get to the blue light, then you flash your teeth like lamps, It's good for the disco and some teenagers, but that was the side effect of that. But I don't think it's used anymore, but maybe in some places maybe it is.
Just allow me one comment on the zirconium, because
Oh, zirconium. Zirconium is just a new thing. Nobody knows much about that. What I know about zirconium, that this is a potent piezoelectric material. When you load it, you get electric current.
we've seen some very bad cases of zirconium toxicity that we documented with the urine
Yes.
studies. Very terrible, and at least in Germany now, it's been touted as an alternative since Vera proved that palladium is bad, and lots of clinicians found it. They're touting now zirconium as a great alternative, and it's a terrible material in a lot of people.
Zirconium is the next transition metal. It is like that. When dentistry has problem with material, then they go to periodic system and pick next one. and there is a problem, they pick next one. The palladium is very unpopular, especially in Germany, because it's a lot of people sick. What did they do? They put away palladium, they put in iridium. Now we get iridium sensitive people. They take away iridium, they put in indium. And so go on, but the periodic system will finish somewhere with uranium and plutonium. We didn't have plutonium bridges yet, but it will come, if they... I'm really sure about that. This is really ridiculous. We are using the most terrible part of periodic system. All of our materials are lying in the middle, where all this poison is. are just choosing that all the time. This case, you see, sometimes we don't have too much teeth left to substance, but it is very nicely distributed in the arch. Then it's not so difficult to put a ceramic bridge on that. And it is not even bonded, because this girl, she was terribly allergic to really all plastic materials, all bonding materials. And later, some 2 years after, she wanted to fix a little bit more teeth. Now she has one tooth left, which is original, this ugly one. But it works because her only choice was really to take away everything and use some prosthesis, but it was impossible because she couldn't have this metacrillate. Another one patient, sorry that they are jumping like that. These pictures are taken some years ago before I learned myself the camera is supposed to be the same as the mouth, you know. But as you see, we are all a little bit poisoned by mercury. Little eccentric, as I said. This is a patient from Düsseldorf. You know, it's a funny thing, because Inceram is coming out of France. Then it's developed in Germany. Then nobody is doing it in Germany. We let us have Germans that, and we are doing it. Now we get German patients to Sweden, because they cannot find a dentist in Germany who is doing it. But they developed that. Oh, they are working in some university somewhere, a little bit, you know, they're hiding, maybe in down basement somewhere. And nobody wanted to do that. As you see, it's quite a thick construction. It's a special construction in the front, because we cannot make an arch. We have to have another reinforcement in the form, resistance form as we call it. We have written a little brochure about that with things, but it takes time. It looks like that on the model. We have make some extension too, because it's possible, some extra unit. And we put it in. Now it's like that, you know.
It's a Panavia cement do you use for this? No, what kind
We
of
don't
cement?
use Panavia cement, no.
It's only oxygen. What's cement?
No, I will come to the cementation and what we use just.
Okay.
What about the mandibles, where you do have some flexing of the mandible itself? You have lots of long span bridges of the porcelain that you use in the mandible as opposed to the maxilla?
Yes, you know, I know what you are coming at. If this movement in mandibula is doing something, you know, if it's possible for me, then I divide it in two pieces in the middle. If it's not possible, I have to make it in one piece, because everybody is aware about this movement in mandibula. Even when you make these implants and titanium bridges and whatever, if it's possible, you have enough teeth to divide it. It makes me to feel more sure. I do that, but we didn't have any accident with that yet. But of course, you have to think about all these things when you are constructing bridges. She is happy. She came back next year to get the next bridge down in there, and she is feeling well. This is not just show up some beautiful work. It's not question of that, you know. For aesthetic dentistry can make nicer. This is a question of principles. I am not showing the best, nicest work. There's another one which is like that, you know. I think we have done it when we were on the boat, you know. This one patient, he was referred from a clinic for implantatology because he was waiting for next transplant of kidney, the third one. The 2 transplant of kidneys were rejected, and they wanted to have him clean from all possible overload or negative effect, whatever possible. He was metal sensitive in Melissa, of course, and he was blind too. It explains how it looks, because he couldn't check his dentist's work. It doesn't look very sanitary, as we say. And we just clean it up and put in ceramic. You see at the gums they are feeling much comfortable with this material. And the transplantation of kidneys is perfectly performed in 3 years now. I cannot say that this made that, but maybe we contributed to that, because the overload on kidneys from mercury and cadmium is quite disaster. This is an interesting case, because this is a lady in 65 years old, which has ALS. Some 3 years ago, progressive ALS. And she was terribly allergic to gold in Melissa and to mercury and cadmium. And this is nothing, this is just routine. We made some in-serum crowns and bridges and restorations. This is the same lady 3 years after. And you know, she's not good in brushing teeth and things because she couldn't speak, she couldn't move. And if we say after 3 years, you know, it has to be a question, is she alive? Yes, she is very much alive. She is very improved. She's talking normally now. And she has about 50–60% of the symptoms and troubles away. The Melissa activity for gold is completely away. We have still some very little activity for inorganic mercury and nickel. And when it comes to inorganic mercury, I will find if maybe there is forgotten somewhere bone, some little piece which is not traceable on X-ray. But she is completely better and better for every year, slowly better. This is in this case the second case of ALS which will be maybe possible to show up in the literature. Other is coming from Sweden, which complete recovery of ALS. It's just case report, but it's interesting to see that. We cannot say I can cure ALS patients. I cannot really say so. But this is interesting case. And they tell you, okay, it was wrong diagnosis. Oh, I am very happy for that. We have about 25 multiple sclerosis cases who had very wrong diagnosis, which are completely cured today. They have no diagnosis at all. May I say, you know, it's a pity about your neurologic department because you put a lot of wrong diagnoses on people. You scare them to death, you know. You scare them that they are sitting in a wheelchair. And then we unscare them and they jump out, you know, after some year. You see, it's good to have a psychological somewhere, you know. But I will show you just soon, if you have still patience, some scientific data. It looks like from my window when I go home after work. It doesn't mean that I work very late, you know, because I am, as Vera nicely said, I am work shy. But it is that in Sweden it's often very dark. We have, you know, in middle of the night at 1 o'clock in the afternoon, in winter. But you are welcome on summer. It's light around the clock. It was that, and if you still have some minutes, I just like to show some overhead. Do we have time?
Want to do some overheads? Yes, sir.
Yes, I'd like to. It's very short. It's a preview of a little study because this was clinic, and we have to talk some science too. Oops, what was it?
A cap.
There. It was a cap.
Not to worry.
Thank you.
Didn't work anyway.
Thank you.
When are you going to talk about the cement?
Yes, can we take this about cement later when it's a question, because we are a little bit running out of time.
Okay, thank you.
Oh, this was the cup, or?
No, slide.
But isn't it like that?
There you go. Okay.
Oh,
Yeah, it's because I'm full Ukrainian. You're just partially smarter than me.
thank you. Oh, if you see that, yes, it is just example for the chemical analysis of what is it contain when we take this sample with this polishing disc. For instance, a titanium cast bridge. Of course, there's a lot of titanium in that, 98.6%. But we find chrome, cobalt, nickel, copper, zinc, and zirconium. Allergologically, the patient was totally allergic to cobalt and nickel. It was disaster. Then if you don't know what they have in it, if you don't have control about these materials, then you cannot say that you take away this cobalt and chrome and gold and everything, and it's coming back, you know, like jumping out. Another one is just showing up the problems with manufacturers. This is a cadmium-free gutta perca. which contains more cadmium than this which was supposed to have cadmium. It was only 5 micrograms. I think, you know, when it was in Sweden, it was a law that nothing of that is allowed to have any cadmium. They just, you know, put the new labels on these boxes, cadmium free. Then you don't believe people what they say in their products. You have to make analysis of that to know. Okay. This is a very short preview. This is a little study which is now to be published in US. And this is our patients. This is this proton microscopy. If I show you, if you look at granulocytes, white blood cells, in our patients, for instance, in aspect of magnesium, this is intracellularly. You see that this group of patients are lying very high. The normal patient controls to the right. There is a normal value, which is lying about 700. It's microgram per gram or ppm. We see it's very much elevated. This we can find, and this is very statistically significant that there is a difference between sick and healthy people. This was one thing. I take some more of these elements because we can check a lot of different elements. Yes. This is granulocytes in patients versus control in aspect of calcium. You see intracellular calcium is very high. It's almost at the same level when the cell dies in apoptosis. You have an increase of calcium intracellularly in apoptosis. It's almost there. And you look at the controls, they are not playing the same division at all. And the same difference is manganese, iron, zinc. There is a difference too, but this is not so still statistically significant on group level, but not in the individual level. And this is a proof that sick people, they have changes. It's good to show with this very advanced technology, you know, that they maybe believe you. This is in granulocytes, and now we are looking before and after our treatment. We didn't put some extra zinc, or we didn't take away calcium, because if you have deficiency of calcium, you can give people some pills with calcium. It will not go intracellularly anyhow. But if you have too much calcium, what do you take? Do you take away calcium from them? It's not possible, really. No, we took away metals, amalgam and gold, and the body has a beautiful chance to recover itself. You see, calcium before and after treatment comes to normal automatically. The same with manganese, or the same with iron, the same with zinc. It will completely recover itself. And at the same time, it is not shown here because this is a part of a little bit larger study. It shows up the decline of MELISA activity, but the Vera, she's taking care about that part of this study. This is the same team working together with, you know. The same with erythrocytes. We have different changes in different blood cells. And as you see here, magnesium was too low in erythrocytes, and it goes up to normal. The calcium was still high in erythrocyte, like in white blood cells. It comes down. Even copper comes down. You see, it's very little difference, but still is statistically significant, low significance, but it is. And the zinc will normalize. This is quite highly statistical. It means that we did something. We make intervention, and it will recover. And then happen more funny things. If we are looking at the level of, for instance, mercury in erythrocytes, this is made with ICP-MS technique, then we see that our patient group, they are lying higher. But according to toxicological standards, they are lying within a normal. It's about 50 nanomole per liter. It's still, in some countries, they say this is normal. I will not call it normal, I will call it usual. And people who are not sick, they still have some mercury in erythrocytes. You see that, controls. They are living a little bit, they are really normal. This is good. Then, if it's normal to have mercury in blood, then it will be no change if we do something about that. Now happens things that if we treat these patients with our dental work, that they become subnormal, completely subnormal. They go down to almost nothing. And we believe that this level of mercury in erythrocytes shows the background. Eating fish, industry pollution, maybe some rest still in tissue, which is an ionic form, which is not cleaned up of the body. But I think the normal is 0. Nothing else. But now they call it they are subnormal. It's good. We can make people subnormal toxic. This is not bad, It's not everybody can do that. If you look at the same business, at plasma, not in erythrocyte, the same difference, patients and controls. Oh, they are really normal. It's only 20 or 19 nanomole per liter. But still, if we make our treatment, which is mostly psychological, of course, then they get very crazy and they get absolutely subnormal. The plasma mercury will be scared and disappears, evaporate somewhere, through years maybe. Now, this is just show that this is effective what we are doing. But we don't have to talk to each other that the most of mercury in mankind is coming from tooth fillings and not from the fish. Because if you want to eat fish to get to this level again, you have to eat 1 whale a week, something like that. And I don't like it, it's too much. It's really too much. Oh, this is what I have to show you. Thank you very much for your attention. We did take more time, but
You can take more time if you want. You got more?
No, it's
more
okay.
overheads?
No, we should like that. There are some questions I'd like to answer. I will take that one again. Yes, I got one preliminary question before other people raised hands. The lady here, what kind of cement we use? We have these problems with people allergic to polymer materials. They scared us. It's increasing, it's exploding plastic allergies. We have found that they are really rare, but there are people allergic to plastic cements. What do? We used some cements which are made by Vivadent, which are color pigment free, a special batch. Or you can buy it because it does not exist. It's the same like a special version of Heliomola, which they made for us, a special batch, which is color pigment free. And this is interesting because they will produce it. They promise now they will produce it as a standard. They took away all this titanium dioxide, iron oxide, cadmiums, and all of these things. And what happened? People who have been allergic to these materials, they are not allergic when we take metals away. What they are allergic to. And we have still about 80% of people allergic to composite resins became not allergic when we clean it up, this metal mass. We have still 20% allergic to composite fillings of this little sample. What are allergic to? When we take away these accelerators, inhibitors, preservatives, all these ultraviolet light things, or go back to 4-meter bond, which is very simple, with no of this stuff in it, then again we can clean half of these patients away. They are not allergic to ground in the plastic, not to metacrylate. They are allergic to all additives. And then in the last group, we still find single person who are allergic to plastic. But these persons are allergic to everything. Multiple chemical sensitive, they're allergic to their husbands, and it's no desensitization helps. No, really, to perfumes, to flowers, to everything. Like the girl which get this Inceram bridge made with phosphate cement. It was impossible. We don't know what to do with them. Some of them recover, and the allergenicity goes down. Maybe it's question just of the whole immune system is up, all of them. That's why we use, the principle is so, we use as few material as possible. One cement, one porcelain, one composite, and finito. No more. Because if the patient comes to me and says, I am allergic to these new white fillings, and open the mouth and I see there's 25 different materials, which one? Which compound of them? The only thing to do is to just rip it off all of that and start from the beginning. And this is not funny when they are doing it the third time. Sometimes they have no teeth left, after all these things. That's why we are talking about this individual biocompatibility context. There is very primitive and very simple possibility to test that. You make a little tablet of your material, a piece of that, and the patient put it in the mouth and they feel what happens. So it's so easy. We don't have to go to biokinesology. It's very primitive. If they don't feel anything, it's no guarantee that it's okay. But anyhow, if they are allergic or if they have problem, they feel it immediately almost. It's burning, it's itching, the knees are going together, things like that. And we have in the future, Vera Stejska, she promised us she's now doing some research about MELISA 4 components in plastic materials, because it's no problem to do it, as I understand, theoretically. She can do it in MELISA, but we still need some research money and time. Then we use, as few materials as possible, with very little pigmentation or no color at all. I use Superbond clear. This one I put the carbon fiber post-waste. I used it as cement. You can use it whatever. It's both cement and denting, bonding, and enamel bonding in one piece. I found 2 people allergic to Superbond, 2 of these 1,000. But you have made clinical trial, but you don't put the bridge, like that in this size, the first trial. You have to try this cement firstly to make a temporary crown of the cement, to put it in and wait 3 weeks. But hopefully we will get more specific tests for that. Because the skin test doesn't help. What are they doing? They are taking out single components of this polymer. They take monomer, put it on your skin, and you get reaction. You're allergic, they say. I don't have to make skin test because it's written on the box. It's not allowed to be touched with your skin because it's allergic. They say it on the box. But it's another way when it's polymerized, if it's allergic or not. Of course, if you have very little molecule, it will pass all these membranes and stops it. It will be reacted. If it's a very large molecule like this, GMA is enormous molecule which will not pass if it's properly treated, If you hardened your composite enough. That's why I don't used to say about cement. We have been chosen cement. We use Vivadens product, not because it's the best company in the world, but because we got a cooperation with them. They give us 100% declaration, which is classified. It was very, 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 secrets about that. You know what was secret? Titanium dioxide and iron dioxide. These are the only secret parts in this very secret. But they gave us everything, all this declaration, and they gave us these special batches. And then we say, if we are happy with that material, it works. It's performing well clinically, that we don't have to look after many others. But we have been using as well some other materials like cements from Mirage. It depends on individual sensitivity. You have to find cement before you put the large bridge on.
Let me interrupt. We have to get going on this. Save your questions for tomorrow's panel discussion, okay? So write them all down, and if you have some, save them for tomorrow. Let's take a 20-minute break. Peter has some announcements to make. Hold on a second. After he finishes, we'll do a 20-minute break and be back for Dr. Haley's speech.
This is about two fundraising events that are happening here.
What company? Super
One
Bonus
is from the
company,
Sun
what
It's
company?
a Morita company in
Oh,
Japan.
Morita.
Anyone signing up here for either for
It's
both
like
seminars, June 5
Panavies
or
come
June
from
5 to
Morita
8
too.
in Scottsdale.
I know, but we have
It's
problems.
a refund, and that's for the first day, June 5. You get a refund, and $75 of that